First of all, thank you very much for this kind invitation. I'd like to thank my dear friend, Professor Rufino Silva, and the scientific board of the Portuguese Retinal Study Group for inviting me to give this lecture on diabetic choroidopathy, a novel approach to an old story. These are my disclosures. So it's an outstanding honor being in front of you all, because the new attention on diabetic choroidopathy was highlighted by several Portuguese groups within the last years. And they tried to focus again the attention of the scientific community on this topic, the diabetic choroidopathy. This is one very interesting review from the group of Professor Silva, and this is another important review. And above all, they continued to work on this subject with an international joint group with the Massachusetts High and here with my dear friend Ines Lines, and developed new imaging modalities to study this disease. And above all, they find very interesting findings related to the choroidal vascularity. So the choroid is a highly vascularized structure localized between the lamina fusca and the retinal pigment epithelium, and it extends anteriorly from the ora serrata to the optic nerve. It's a multi-layered structure and is composed by the choriocapillaries plus its basal membrane, which is one of the part of the pentalaminar Brooks membrane. The medium-sized vessels are also known as Sattler's layers, the large vessels also known as Haller's layer, and the suprachoroidal space. The medium-sized arteries of the Sattler's layer give rise to the choriocapillaries, which has an hexagonal or lobular shape structure with a single layer or fenestrated capillaries. And these capillaries have pores. And these pores are mainly localized in the RPE phase of the choriocapillaries. This organization is mostly due to the importance of being permeable to proteins, and in this side, because generating a high oncotic pressure in this area, in between the choriocapillaries and the Brooks membrane, keeps dry the subretinal space because of generating the movements of fluid out of the retina into the choroid. The choroid receives more than 70% of the blood supply from the ophthalmic artery, with the highest rate per weight in any tissue. And due to the large extension of the choriocapillaries, the speed of blood flow substantially reduced by 77% of the normal speed in retinal capillaries. The main physiologic function of the choroid are to provide oxygen and nutrients, so to feed the outer retinal layers and the prelaminar portion of the optic nerve, to regulate the homeostasis and the nourishment of the RPE, and to maintain the thermal regulation. Diabetes-induced non-inflammatory degeneration have been already described. For example, we have the choriocapillaries dropout, luminal narrowing, thickening of the basement membrane, and atherosclerotic processes. The histopathologic studies on type 2 diabetes reported that there is a decreased alkaline phosphatase activity in choriocapillaries. And this is mostly due to a loss of viable endothelial cells with a consequent degeneration of the choriocapillaries. There is obstruction of capillaries and also the presence of choroidal aneurysms. And the Brooks membrane shows degenerative changes. But one of the most important things that we can observe from these histological studies is the presence of intrachoroidal neovascularizations. This is an example of the choriocapillaries dropout in a healthy subject and the rarefaction of the choriocapillaries in a diabetic patient. This is an example of an intrachoroidal neovascularization. This is a novel entity because we are normally facing neovascularization which develop in between the Brooks membrane and the RPE. And these are neovascularization that are primarily underneath the Brooks membrane, so directly at the level of the choriocapillaries. And these structures typically develop such focal vascular dilation that are called microaneurysm, but they are localized only at the level of these neovascular tissues. As every tissue that we are going to examine underneath the RPE, we examine with the ICGA. And the typical findings of ICGA in case of diabetic choroidopathy are late-phase choroidal hypoperfusion that sometimes correspond to the findings that we have at the level of the retina. Inverted flow phenomenon, we have the perfusion of the retinal arteries, but there is no perfusion of the choroidal arteries. And we have large hyperfluorescent spot in the late phases. This is an inversion phase, but these are generally related to the presence of elevated levels of HbA1c. Now we are in the area of OCT angiography, and OCT angiography has technically revolutionized the imaging of the retina because it provides a depth-resolved imaging of the different retinal layers. But it also provides some interesting findings at the level of the choriocapillaries, the subtler layer, and the alveolar layer. We all know that in terms of diabetic retinopathy-induced vascular impairment, we have some focal muscular impairment that could be highlighted by the OCT angiography. For example, a reduction of the vascular network or some focal dilations. And it highlights the presence, for example, of neovascularization, in this case at the level of the optic nerve. We have the beautiful view of the entire neovascularization, and this could be imaged in a depth-resolved way, so we are able to distinguish only the neovascularization and the topographical relations with the other part of the retina. But also, we have, since it is a 3D examination, we are able to distinguish where it is exactly located in terms of actual direction. And so, we can see that this is not only an epiretinal neovascularization, but it has also some vitreoretinal proliferation. This is a cross-sectional high-resolution OCT angiography. Nevertheless, actually, probably the combined approach, the hybrid angiography, both provides information related to the activity, to the leakage of the lesion, and to the morphology of the lesion with two functional examinations. So our purpose in this case was to perform a fully automated quantitative assessment of the retinal and choroidal microvasculature in eyes with diabetic maculopathy using OCT angiography, and to identify a potential functional relationship between retinal and choroidal vascularities in case of perfusion impairment. A retrospective review of patients suffering from diabetic maculopathy analyzed with the spectralis OCTA, which is based on a probabilistic amplitude decorrelation approach. We simultaneously analyzed the superficial, the deep capillary plexus, and the choriocapillaries, and each image per patient was analyzed with a custom-built software which is called AngioCT Tool Plus, which provides a fully automated quantification of the retinal and choroidal vascularities. Then we perform a comparative analysis with a group of healthy subjects. The AngioCT tool works almost in this way. It takes information from the superficial and deep capillary plexus and also from the choriocapillaries. And in order to exclude potential confounding factor, for example, hard exudates or cystoid spaces, it also works on structural imaging in order to detect the presence of hard exudates. These are not angiograms. These are only ANFAS OCT to detect this kind of clusters of hyperreflective material due to hard exudates or the intraretinal cystoid spaces. And it also provides some findings related to FAZ matrix and vascular or avascular surfaces. This is the assessment of the vascular density and the flow voids as previously described with the Fanzelker algorithm. 48 eyes with diabetic maculopathy and 47 healthy control were analyzed. There is a statistically significant difference in terms of fast surface between the superficial and the deep capillary plexus, but this, as we have already demonstrated, is mostly related to segmentation strategies. There are no difference reported for vascular density in between the superficial capillary plexus and the deep capillary plexus. The capillary density values were significantly lower in all retinal vascular layers at the end, at the level of the choriocapillaries in diabetic patients compared to controls. A positive linear correlation in terms of vascular densities was reported between the choriocapillaries and the superficial or deep capillary plexus in healthy subjects. This corresponds to the function of the perfusion at the level of the choriocapillaries or the retinal layers in a healthy subject. But interestingly, a negative linear correlation in terms of vascular density was reported between choriocapillaries and both the two retinal plexuses at the level of, in case of diabetic patients. It means that the more is impaired the choriocapillaries perfusion, the more is active the vascular response from the retina and vice versa. So the more is impaired the vascular density at the level of the superficial or deep capillary plexus, the more the choriocapillary tends to increase the level of perfusion. A fully automated quantitative OCTA approach is a useful imaging system because it is able to detect diabetic-induced microvascular changes. The diabetic maculopathy simultaneously affects the superficial and the deep capillary plexus without a statistically significant difference between the two. And FAZ metrics should be considered, but they mostly rely on segmentation strategies of OCT angiograms. Diabetic vascular damage is clearly shown both at the level of the retinal and choroidal vascularities when compared with healthy controls. But interestingly, the retinal and choroidal vascular networks seem functionally interconnected. There are already some evidences of potential correlation between the perfusion of the retina and the perfusion of the choriocapillaries, since in case of AMM, a potential pathogenetic mechanism is related to a simultaneous reduced perfusion of both the capillary plexus and choriocapillaries. In MACTEL type 2, we have a photoreceptors loss, mostly associated with retinal vascular abnormalities. And in case of diabetic maculopathy, we have a photoreceptor loss associated with deep capillary non-perfusion, as it has been demonstrated. So the negative linear we hypothesize that the negative linear correlation between choriocapillaries and retinal vascularity is a potential compensatory mechanism that we have in case of diabetic maculopathy that supplies the inner or the outer retinal layers in case of chronic retinal or choroidal insufficiency. Which are the perspectives in terms of retinal imaging and in terms of understanding the origin and the pathophysiology of diabetic choroidopathy? So this is choriocapillaries of an healthy subject. And in this case, the blood pressure is about 110/75. And when we artificially increase the blood pressure of this subject toward a level of 143 on 100 almost, we have very similar images. This is the differential map, and it's quite hard to detect some red spot in this image that are highlighting some perfusion changes. So it means that with an increase in terms of blood pressure, there are some compensating mechanisms that inhibit potential changes in terms of perfusion at the level of the choriocapillaries. This is a patient with severe non-proliferative diabetic retinopathy, and this is the OCT angiogram of the choriocapillaries with a blood pressure of 126/80. And this is what we obtain in a patient when we increase artificially with an isometric exercise with a blood pressure ranging 165/100. And this is the differential map. So what we can obtain from this image is that in a patient with diabetic choroidopathy, there is a basal reduction in terms of vascular perfusion at the level of the choriocapillaries compared with a healthy subject. Thank you very much for your kind attention.